Today I am going to show you the very important procedure, that is arthroscopic resection of distal clavicle. We also call this one is the Mumford procedure, and this gentleman is 25-year-old and he have history of fall 6 months ago, and after that he complains of pain and swelling over the AC joint and not getting relieved with the physiotherapy and corticosteroid injection. So today we have decided to go for the surgery and resection of the distal clavicle. In this, we are going to remove either 3 to 5 mm of distal clavicle through the arthroscopic procedure. So now I am going to show you the MRI of this gentleman, and after that I will take you to the theater to show how we are going to do this procedure. So this is the MRI image of this gentleman, and you can see this is the lateral end of the clavicle and this is the acromion, and you can see this hyperdense fluid signal which shows swelling and inflammation of the synovium. We have given injection 3 months before, so I don't think that this is the swelling is water is because of the injection. And you can see this surface is also very irregular. So now I am going to do the distal resection of the clavicle in the theater. So now we are going to start the arthroscopy of the left shoulder, and we will do the Mumford procedure. For that we have to do the site marking first. I have already marked the spine of scapula, and this is the posterior lateral corner of the acromion. This is the anterior border. Posterior portal we are going to put 2 cm down and medial, and we'll feel the coracoid process. Coracoid process is 4 cm down to the acromioclavicular joint, where we are going to make the another portal for this procedure, and then we are going to do the lateral portal to do the bursectomy and dissection of the acromion. 5 cm down the acromion, the area is very safe. So now I'm going to do make the posterior portal. So after incision, I'm going to put one artery to separate the muscle fiber and reaches to the capsule, and you have to feel the glenoid neck. And then I'm going to put the obturator along with the sheath. While putting the sheath, you have to always put in the direction of coracoid and in the horizontal direction facing towards the coracoid. After filling the glenoid, first you will feel the glenoid on the medial side, just lateral to that you will feel the joint space, and now this is done. And then after putting the scope, I am going to do the scopy of the subacromial space, and now I'm going to put the lateral portal and putting the spinal needle, and through that you can see the tissue is very inflamed. So for this Mumford procedure, you have to 3-4 steps you have to do. First, make the lateral portal to decompress the acromion and do the bursectomy to see the rotator cuff tendons. And after that, second things, you can use the burr to decompress the acromion and clavicle, and then make a portal anteriorly directly just below the AC joint to widen the space between the clavicle and acromion. We should dissect the 5 to 7 mm of clavicle. So now you can see this, I'm just removing the tissue on the under surface of the acromion, and after that I'm going to use the burr. See, I'm just removing the capsule. Now the joint is open, you can see clearly. See, this space has been created now, and now you can use the burr. Just make another portal. I will clean the tissue in between the joint, and then I'll use the burr to decompress the lateral end and the clavicular end of the AC joint. This I'm doing the decompress from the lateral side. So see, you can see the clavicle very easily after this. While doing the decompression, always go for the making the smooth surface, otherwise it will cause the impingement again. And through this view is from the, like I'm putting it through the AC joint to widen the clavicle and the acromion. Try to remove the 5 to 6 mm of clavicle to make the space 7 to 8 mm. And I think this little bit bone is there, so I'm going to remove that. So you have to decompress the clavicle with the burr, and you can see the space is good, space is created. Now you check with the probe. Try to smoothen the edges for both sides. Now I will show you through the anterior portal, and you can see the clear gutter between the AC joint. So this is all done now. Thank you for watching this video.